I liked how you said like really being in the field is what you're trained for, but also be honest in like what in your whole life do you want to accomplish, and there's lots of different ways you can use your degrees.
It's okay that you don't do the same thing forever, and I think that it's fun to do different things. So don't be discouraged if you don't get to do everything at once, but you'll get to do it at some point probably. Just to talk a little bit about Doctors of the World, this is one of the things I really like about this organization in particular, is that they have branches in 14 different countries that are offices, where they do fundraising, but also they have staff. But they don't just do humanitarian work in places outside of their own country, but they actually do domestic projects in all the countries where they have offices, because that is a reality to them also, that there are needs no matter where you are. And a lot of their domestic projects are for immigrant populations in Europe, so people who don't have access to the National Healthcare Service and things like that. In the U.S. it looks a little different. We have a lot of patients who are actually U.S. citizens who just don't have health care. So anyway, there's definitely that kind of work to be done all over the place. And my job is kind of a merging of that, so it's kind of exciting for them.
Finding the right fit is finding a supervisor that you can really connect to and learn a lot from. Almost finding a bit of a mentor in that role, so that we as professionals actually continue to develop. So for me, that was, I